will continue to be a key battleground for all political parties as the general election edges closer.
Well, now the organisation which represents all NHS groups has come up with its own plan of what it would like to see. One of its key proposals is linking health spending to the growth of the economy. Well, to tell us more is Niall Dickson, who is Chief Executive of the NHS Confederation. Good morning, Niall. Thanks for your time this morning. We know that we're going to hear an awful lot about this from the various different political parties over the next few weeks. So I guess it's important for you guys to get your pitch in early. What's the main message that you're sending out today?
Well, everybody understands that the Brexit negotiations are going to dominate this election. But I think we feel that the country faces another set of really important decisions around the funding, the cost, and indeed the reform of health and care services, which is why we believe that the level of funding should be linked to the gross domestic product, so that when the economy grows, then that funding grows. That we need to establish an independent body to assess level of need and the trends over the next 10 or 20 years. So it's about trying to establish something that's independent of government, but also gives some clarity to government around, and indeed to the population, about the levels of funding that are going into the system.
Linking it to GDP is an interesting one, isn't it? I know that traditionally the UK spends less per head GDP on health than other countries do, the USA, for example, Japan, France and Germany. But on the other hand, if you're linking it to economic performance, despite the fact that things have been pretty robust in the last couple of years, of course, in the UK, it can dip down, and health needs don't themselves necessarily respond to that. They will be just as acute as ever. Isn't there a danger you end up with an underfunded NHS that way?
Well, I suppose there is. The answer is that if you look at defence and you look at international aid, both of which have been linked, I think they've benefited from that clarity about how much government, or indeed all of us, are willing to spend on that area. Of course, if a government finds itself with an economy that's going into recession, as we did in 2008, whether we're linked to GDP or not, the answer is that funding levels into health and care are very likely to suffer. I mean, people will make arguments to try and defend what is a really difficult area. And what differentiates, I think, health and care perhaps from some other areas is simply the level of demand. And if you look across the next 20 years, the number of people who are over 85 is going to double. Say that again, is going to double. The effect of that on health and care is really very profound, and we need to ask ourselves some pretty hard questions. We're not saying that funding is the be-all and end-all. It's necessary, but it's not sufficient. The system needs to deal with a massive workforce crisis at the moment, and it also needs to transform itself. It, frankly, is not fit for purpose at the moment. But setting those things aside, if it doesn't get enough funding, it will not be able to achieve either of those things as well.
And talking about our growing elderly population, there has been so much discussion in recent years about integrating health and social care. We don't seem to be making a huge amount of progress. It may become a devolved issue in the nations. I know in the Greater Manchester area that's been talked about, whether they could have control over their health and social care budgets there. How do you see that actually panning out?
Well, I think you're right that integrating services, that is to say, making sure that instead of having a system which is incentivised at the moment really to do one-off interventions and to do more and more of them, has to be able to cope with a very large number of elderly people who've got often lots of different long-term conditions. And that means effectively trying to treat them earlier in the community and organising services so that when an elderly person finds themselves going up the chain, as it were, towards a hospital, that the system is geared to minimising the time that they have at the hospital end and maximising the amount of prevention and the support that you can give in the community. We are some way away from achieving that, but I think the whole system is very committed to moving towards it. But we would argue that there's also a need for some transitional funding to enable people to build up new services while the old ones are run down.
And if I can just ask you briefly there, you're also talking about the option of setting up some kind of independent ombudsman to oversee funding of the NHS. A lot of voters, I think, would very much like to see the whole question of funding taken out of the sort of bish-bash-bosh of political parties. Is that feasible?
No, I don't think it is. It's always going to remain a political question. But what we're saying is that if you set up something like an Office for Budget Responsibility for Health, then that organisation will at least be able to provide the evidence and then we can have the political argument, which we will always have, about how much as a society do we want to go to meet those needs. But having an objective assessment of those needs, and frankly holding my members to account for the value for money that they provide, seems to us a way in which you could at least improve the quality of the debate.
OK, thank you very much indeed. Good to talk to you. Niall Dickson, Chief Executive of the NHS Confederation.
Now, big trucks, petrol, massive tyres, mud.